supporting their needing care all throughout the year. Nationally, unpaid carers save the economy around £132 billion a year. The West Yorkshire Healthcare Partnership Unpaid Carers Programme is committed to supporting and recognising unpaid working carers living or working within its 5 local places. These include Bradford, Craven District, Leeds, Kirklees, Calderdale and Wakefield. Evidence shows that many unpaid carers across the West Yorkshire Healthcare Partnership workforce face a multitude of challenges because of both caring and being from an ethnic minorities background. All organisations that are from the West Yorkshire Healthcare Partnership want their health and care system to be a supportive environment where they fully understand the needs of its diverse workforce. Today's webinar, which is titled Working Carers in a VCSE Setting, will open up a discussion around the challenges and inequalities, as well as understanding how managers can best support their staff through the Working Carers Passport. Last week, Race Equality Network and West Yorkshire Healthcare Partnership launched the Message in a Bottle campaign aimed at a contingency planning for carers. We have videos in 7 different languages, and the links will be available in the chat box on the Race Equality Network YouTube channel and West Yorkshire Healthcare Partnership website. Today we'll be hearing from our amazing panel, Claire Turner, who is the Chief Executive for Carers Leeds and will provide an overview of the carers agenda and the support offered to its working carers. We will also hear from Shadim Hussain, who is the CEO of My Family Group, Calvinda Duggan, who is caring for her parents, Akik Sadiq, who is the manager at West Bowling Youth Initiative, Rubina Burhan, who is the manager at Girlington Community Centre. They have all kindly offered to share their personal lived experiences and how they balance their busy working life whilst providing unpaid care for loved ones. Please note that this session is recorded and will be used to show clips on both the Race Equality Network YouTube channel and West Yorkshire Healthcare Partnership website. If you're not happy with that, can you just please turn your cameras off? But it'd be great if you could leave your cameras on so that we can interact. There will be a poll shown at the beginning of the session. It'll take around 30 seconds for you to complete, and then again throughout the session. Do you want to share the first poll, please?
I'll do.
Can everybody see that? Can everybody see that? It's just multiple questions that you have to answer.
Yeah, has everybody completed that? Brilliant. Okay. I'd like to introduce to you, I'd like to introduce our first guest, Claire Turner, who I'll hand over to. Thank you, Claire.
Thanks, Adiba. Yeah, really delighted to be here. So I'm a working carer, but I don't have experience of being a working carer from an ethnic minority, and I know others are going to bring that perspective to this session today. So the perspective I'm going to bring, I suppose, is as a chief executive of a carer centre. You know, we're a charity providing information, advice and support to unpaid adult and parent carers across the city, and we also try and influence other people in Leeds to act directly to benefit carers. At Carers Leeds, we've got a strong commitment to being an equal, diverse and inclusive organisation from the perspective of both our staff and the carers we support. And we're on a journey like others. We've got a long way to go, but I hope I've got something to offer to this session, but also a lot to learn. I'm going to draw a bit on data and research evidence on working carers from ethnic minorities. And then I'm going to finally just share some of the practical things that we're doing at Carers Leeds and with other partners in the city to support working carers. But first, I suppose I just wanted to say a few things about working carers generally. I think from my perspective, it feels really important that we reframe the way that we think and we talk about working carers. You know, we need to move away from this idea of seeing working carers as a kind of niche concern that only impacts a small number of people in the workforce. You know, being a carer is commonplace. You know, 3 in 5 of us will be carers at some point in our lives. And when it comes to working carers, you know, Adiba mentioned the kind of national statistics of 1 in 7 of the workforce are carers. You know, when you look at the NHS, it's 1 in 3. When we did some work at Carers Lead, it was 1 in 2, you know, and we also know that many people don't identify as carers. You know, we hear that a lot at Carers Lead. I'm just a mum, I'm a daughter, I'm a friend, I'm a partner. It's just what you do. So we know these statistics are likely to be a gross underestimation of the true picture of working carers. And we know lots more people became carers over the pandemic, for example. So we really need to transform the way we think about combining work and care, and we need to start treating it as a mainstream issue for employers. You know, employers have working carers in their workforce now, whether they know it or not. You know, and if employers want to recruit and retain good staff, they need to think carer across all their policies and practices. But we know there's often a gap between the wants and needs of working carers and their real life experiences of combining work and care. So we know that caring can have an impact on people's career prospects. So Business in the Community and Ipsos did some research recently which said 4 in 10 carers say caring responsibilities prevent them from applying for a job or a promotion. You know, we know that lots of carers leave the labour market, particularly carers in their 40s and 50s. They're most likely to do this. And for lots of those carers, they never return. So even if their caring responsibility ends, they're not returning back to work. And I suppose responses, you know, it's really important to have the right policies. You know, of course, that's a good thing. They're a statement of intent, they're a signal of the level of importance that an employer places on this issue. But we know that policies are not on their own, are not enough. It's about workplace culture, isn't it? So, you know, how does it really feel to be a working carer? What are the attitudes and behaviours of colleagues and managers to working flexibly? You know, if you need to take time off, you need to change your hours, you need to change your working pattern. You know, how comfortable are staff in talking about their caring role if they want to? You know, especially if you're new or if you're going for a promotion. And really, you know, a lot of this is about a line manager role, isn't it? You know, for most of us, our interactions with our line manager are where these organisational policies and practices come to life. You know, time and time again, working carers tell us that their line manager has a huge impact, whether that's good or bad, on their capacity to combine work and care. And so anything that enables line managers to better support working carers is like to make a big difference in reducing this gap between what people need and their real life experience. And flexibility, this is the thing we hear time and time again from carers, that, you know, flexible working needs to be central to any workplace support. So I'm going to go talk a little bit now about I suppose what we understand about working carers from ethnic minorities from data and research evidence. And I also think, I suppose it's important through this workshop to keep other demographic characteristics in mind and how they might intersect. So we know gender, you know, women across every ethnic group take on most of caring responsibilities, especially amongst carers of working age. And older workers, you know, we know when it comes to age, you know, peak caring age, that's the way some people frame it, is between 55 and 64. You know, so what does it feel like to be an older worker and a carer? So just drawing on a bit of the data research, which some people will be familiar with, and certainly we have massive gaps in our understanding. So the best data we've got, I suppose, is the census, and we're waiting for the 2022 census, aren't we? So some of this is really out of date, I suppose. Showed there were just under 600,000 Black and minority ethnic carers in England and Wales, and most of those being working age. You know, and as we all know, this number is increasing and is, as I said before, likely to be a gross underestimation. We know that the older population is and will be becoming increasingly diverse, and this potentially again increases the demands on carers from ethnic minority groups. And set against, I suppose, what we know about caring in general, evidence suggests, and I'm sure we're going to hear some of these stories today that will bring this to life, that some of the experiences of ethnic minority carers may be different and more challenging than those of their white counterparts. So for example, ethnic minority carers are more likely to struggle financially and more likely than white carers to care for more than 20 hours a week. And we know the impact, the more you care, the greater the potential impact on your health, on your money, on your social connections. So some research studies have highlighted higher levels of isolation for Pakistani and Bangladeshi carers, for example, or greater anxiety and depression have also been identified for British Indian carers. And some research suggests that ethnic minority carers are even less likely to self-identify as carers than white carers, and this may be in part what we understand, that in some languages, there are no words that translate as carer. When we're looking at support services, I think, despite these additional challenges, there's more and more evidence suggesting that ethnic minority carers are less likely to access and engage with formal services, and lots of reasons why ethnic minority carers may find services much less satisfactory than white carers. And again, I'm sure lots of these we'll discuss and pick up today, whether that's misconceptions about from service providers about the availability of support from extended families, whether it's language barriers, services not recognising cultural and religious needs, whether it's staff and volunteers not being reflective of the communities they serve. And I think this, coupled with other kind of workplace issues, I suppose, the type of work that you do matters when you're a working carer. If you're in a kind of managerial or professional role, then you're more likely, that's more likely to accommodate flexibility than lower paid and insecure work. They generally offer better salaries and conditions which provide an incentive to stay in work. And when you look at research by organisations like the Joseph Rowntree Foundation or the Runnymede Trust, really highlighting that for some ethnic minority groups having higher rates of in-work poverty than white groups, particularly from Pakistani, Bangladeshi and some black backgrounds, they may also work in those sectors that are less likely to accommodate flexible working, such as hospitality, transport and care. And finally, I suppose this potential experience of ethnic minorities, of carers in the workplace, of racism, this is there's well-documented evidence about the impact of racism at work. A recent report by the Forces Society and the Runnymede Trust, based on research with 2,000 women from ethnic minorities, found that 75% had experienced racism at work and 27% had suffered racial slurs. So all of these combine, I think, to provide a whole host of issues and challenges, and again, I think there are others that are going to speak after me and much better qualified to talk about these things. So finally, what's happening at Carers Leeds and across our city to support working carers, and particularly those from ethnic minorities? We know that at Carers Leeds it's really important that we tailor our support to the demographic profile of the carers in our city if we want to meet the needs of ethnic minority carers. And we also know that we need, the active involvement of carers from ethnic minorities and designing services and delivering services is going to help improve our information, advice and support for working carers. So we have real strong ambitions to improve our work in this regard. And the key questions, I suppose, that we're asking of ourselves and others are, how do we make sure that our services are more inclusive? And how do we reach more and more diverse carers across our city? So obviously we have our core service, which provides information, advice and support to adult and parent carers across Leeds. And that obviously includes working carers. We've got an advice line, we've got carers groups, we've got one-to-one support. We also have an employer-facing working carers project. And I've seen that Madeline is on the call today. So if you have any particular questions about that, I may defer to Madeline. So this is about trying to influence employers to do more. So we have an employer forum, which is a space where employers from across, the public and the private sector can come together to get information and advice, but also to share the practice that they're doing within their organisations. And we're working towards developing a partnership with 1 or 2 employers in the city, using this Carers UK Carer Confident benchmark. And this is a way, I suppose, of us trying to support organisations to be gold standard in the way that they support carers in their workforce. And as part of that, it's really, really important that we share good practice around supporting working carers from ethnic minorities through these forums and the partnerships that we develop. And finally, just to highlight some other things that are happening in the city, we have an anchor Healthy Workplace project, which is very much about supporting those key public sector employers, big employers in our city, to improve their policies and working practices. We've got the Working Carers Passport, which already been mentioned, again in place in Leeds City Council and NHS providers, and we need to do more to get that to other employers. We have our Time for Carers grant, which helps carers. It's a very simple process to apply for some money to take a break. And how you define a break is based on the individual needs of that carer, whether it's to go away for the weekend or have a bench in your garden where you can sit and have a cup of tea. And we've got really good take-up of that from ethnic minority carers, but we also know that there's really poor take-up of short breaks in our city from ethnic minority carers. So there's a project started to look at this and to say, well, what should our offer be then? What could we do differently? We've got the BME dementia service provided by Touchstone, which provides one-to-one and group support for carers, aims to raise awareness of dementia within BME communities, provide culturally appropriate dementia awareness talks that can be delivered in different languages, and we run a forum for professionals. We've also got the Feel Good Factor, a charity base in Chapeltown focused on health and wellbeing, running carers projects focused on ethnic minorities, and that work is coming to an end, but we hope that work will continue under Leeds Black Elders in the future. And we're also at Carers in the early stages some work with Hamara about how we partner to provide better support for ethnic minorities. Okay. So I suppose in conclusion, I want to go back to what I said at the beginning, really, that caring is commonplace. It should be at the heart of our workplace policies and practices. You know, and within that, we must make sure that the wants and needs of ethnic minority carers match the reality of their real life experience, combining work and race. So thank you, and I really look forward to hearing the other speakers today.
Okay, thank you, Claire. It was really informative. Does anybody have any questions for Claire? So we've got Jeff.
Hi. This for Claire. A couple of things that mention is the impact of sudden effects and the welfare of the carers. I was a carer to my mum, who died, and then 6 months later, my dad had liver disease. So it was a sudden impact. I work in the care industry, which is not the most care industry at the time. They don't really care. I would say I'm working 0-hour contracts. It's difficult to get support from care industry. And I had a stroke while caring for my dad. So one of the things is sort of like the support from management and supporting management that are ad hoc management as well. But also the impact of can be very sudden. We have a lot of people who've obviously strokes are very are instant. So is one thing is the support is there for them instantly. If carers having used to do so with carers leads. And the other thing is, and this is sort of my personal bad experience with carers leads, is that there's a lot of geographical issues. So I live in Leeds, and my dad was lived in Scarborough. We had to go over to Scarborough to pick him up, to bring him back, to do appointments and that. But carers Leeds actually rejected me because I lived in Leeds, but my dad lived in Scarborough. And the people in Scarborough said that I should have gone and spoke to you in Leeds. So I fell between. I know there are quite a lot of geographical things, and this was 7 years ago. And the stress of that probably led to my stroke as well, of 2 and 3 years of commuting there and back. Is that sort of thing being measured a bit more now that there is support geographically as well? So I may have just fallen between some staff that just didn't know any support on that.
Claire, if I just get the rest of the questions and then you can just answer them. Is that okay? Because we're just gonna, is anybody else who's got any more questions for Claire? No, okay.
I think Mahbub put his hand up. Mahbub?
Yeah, it just does say, obviously with carers, one of the biggest issues is the fact that they can't get away from the person they're caring for. That is the biggest difficulty that I've come across anyway, because I work with carers at the moment. I've been a carer myself. which was quite an intense period for myself as, obviously a male carer, somebody from a BME background, and then somebody's trying to hold down a job as well and look after the rest of the family and so on. So I think, like I said, the biggest thing for any carer is the fact that, they have difficulties getting away from the individual they're caring for, because often there's no respite care available. And that tends to kind of have a huge impact on the social life. Like I said, leading to self-isolation, all sorts of different things. So I think, obviously, we work with Carers Trust on a national level as well. And currently I'm working on male carers project. So, like I said, even for male carers, it adds a double whammy to it as well, because you've got the family responsibilities, if you like, in the traditional sense, and you've got to try and hold down a job, and obviously the caring duties and so on. So it's, I guess, putting all that into place, it's looking at what kind of things are carers leads doing to kind of support some of those aspects. I'm going back to Jeff's question earlier on. At the moment, I've got an individual who's in Hertfordshire, a male carer who's in Hertfordshire, but the person he's caring for is in Bradford and in Keighley. So he comes up to look after, and I've openly said, you're welcome to participate in male care activities, groups and so on, and get the support as well, even though you're based in Hertfordshire. So I guess, like it says, it is down to the individual sometimes, and how you prepare to support, individuals. Even though, like I said, our council funding only covers Bradford itself.
Claire, are you okay to answer those questions?
Yeah. I mean, firstly, Jeff, I'm so sorry that you had that experience. And it's something I would really like to look at, because I think from our perspective, I think there are these challenges with geographical boundaries, but you were a carer based in Leeds, and we are a caring organisation that supports carers in Leeds. So I'm really sorry that you had that experience. And I think this issue of where people are living in different places from the people they care for is a tricky one, and I think we need to look at that again. So I am really sorry that you had that experience, because I think, as I say, we're an organisation that's designed to support the carer. I think your point about the kind of, like you say, people come to caring in different ways, don't they? For some people, it's very gradual and over time, and for others, like you say, it's this kind of sudden impact. And I think, we do some work with the Leeds hospitals, and particularly kind of thinking about this, about at that point, perhaps when someone's gone into hospital with a sudden illness, that actually you're going to come out of hospital, and you're, as a carer, that person's going to come out, you're going to be a carer, and your life has completely changed from perhaps it was, the week before. And so I think our hospital support workers are really aiming to support people, particularly at that time. To help them navigate, to help them get support, and then obviously refer them back into our service for a more ongoing support, information, advice if they need it. But I really think that that's a service that we would love to expand, because I think there is a lot of need for that, particularly I think in that situation where people are going to come home from hospital and life is going to have changed dramatically. And people don't always realise that at the time. So having us there to say, look, we're here, even if you don't realise you need us yet, we're here. But I will look into that geographical issue, because I think it is really important. And Mahbub, as you said, this idea that actually, of course, you could support people, who are moving between cities. It's really important that people don't fall through those cracks. I think on the issue of breaks, that's always, I'm sure you will see research that's put out by Carers UK and Carers Trust every year, and it always says, of the three issues that carers really care most about, having a break is a massive one. And I think, and that's really part of the rationale for us to be reviewing with Leeds City Council their kind of, short breaks, respite, sitting services, because there are services available, and actually some of the time we're finding in Leeds that they're underused. And that's not because carers don't need a break. So there's other reasons that are getting in the way of that. And some of that, I think we, have had feedback from people to say, well, I don't know who's coming in to look after my dad, so I'm not going to be able to go and have a relaxing time if I'm not quite sure that this person, will be able to look after my father. or that he'll be happy in the situation. So I think there is a lot of work to do in thinking about how we really ensure that our kind of short breaks, respite, sitting service, whatever we call them, really meet the needs of both the carer and the cared for. And I think there are some really interesting examples of projects that I've seen in other parts of the country that are much more, I suppose, in line with the sort of befriending services that we see, that where they try and match people, you know, so that they match people both that maybe need some extra help, but actually match people on interest or background or things that they might have in common. And there's some evidence to suggest that that's then a much more, carers feel much more able to leave the house and to do the thing that they need to do because they feel that their loved one is being looked after in a way that they will experience as a positive. But absolutely, I think that's always in the top three things that carers need. And but I think, yeah, there's definitely more work to do, I think, in terms of making those existing services fit for purpose.
Yeah, thank you, Claire. If anybody else would like to ask Claire any more questions, can you please use the chat box? I'd like to move on to our next speaker, Shadim Hussain, who's the CEO of My Family Group. Thank you, Shadim. And he's going to share his own experiences of being a carer. I hand over to you, Shadim.
Thank you so much, and thank you for the invitation and opportunity to speak. And it's really interesting to have heard from Claire. And I always find this, that you know, when you're sort of knee deep into providing care, often you're not aware of the services that are available, and it's great to hear about the work that Carers Lead is doing. So, but just on my own background, so I've been a carer or was a carer for the last 30 years for both my parents, my mother who had muscular dystrophy, and my father who had a complex range of health issues. And sadly, both of them passed away, you know, through COVID, in fact, over the last year and a half, and not too dissimilar situation to what Jeff was describing, you know, in terms of the extra pressures that are applied when you're going through those sort of acute health situations. So you know, I've had a lifelong experience of caring for mum, but you know, for some reason you didn't really put yourself into the category of being a carer in this way. It was just part of the family dynamics, and I think there is a cultural expectation within South Asian communities and Muslim communities where there's almost a higher level of pressure and expectation to look after parents, and I think that's just a cultural norm, and it's a positive thing that within communities that we do have that, you might say, an additional sense of responsibility, because there isn't the norm of people having elderly folk going into care homes. And I think that's one of the major challenges, and it is a bit of a stigma and a taboo within our communities that, you know, as a community, we're not so comfortable about putting our elderly folk into care homes, and ultimately what this results in is in an additional pressure for individuals who, just as Mehboob was describing, where you're trying to hold up the job, looking after your own family, and then you've got this additional layer of pressure. Now, although, you know, this is, you know, referencing unpaid carers, if you actually look at what a carer does get paid, it's hideous, you know. I think if I remember, it was about £60 a week or something, you know. So you know, and ultimately the hours that you do and the sacrifices you have to make. So one thing is that when somebody does choose to take a carer's allowance, you know, they lose other benefits. So in terms of additional support, I think the conversation does need to start within communities around, you know, what does end of life care look like, and what services are available, because I think that's a time when extreme pressure comes on, and there are various services such as Mary Curry Cancer Hospice, I think it's St James Cancer Hospice in Leeds as well. So there is services that are out there that the community is not aware of. So one thing is about awareness of services. The other thing is tackling the stigmas around care, and having families being admitted into these types of services. And in terms of some of the services that are available, such as short breaks, etc. I think Mahbub made the point that the problem is nobody gets that breathing space to be able to take those breaks. So there isn't really a backup. So I think respite care would be really good, and that's something that, you know, we have in the foster care system, where if a foster carer needs to take a break, that there is a respite carer there. And faith and cultural sensitivity around services is really important. You know, many of you will know Mohammed Rauf from BME Dementia Care. I got more from Mohammed Rauf on 2 phone calls than I got from a dementia specialist coming to my house for 12 visits. And the difference was because he understood my father without having met him, because he knew the cultural norms of that elderly generation. So I think faith and culture sensitivity is really important. You know, from an employer's perspective, I think health management is really key. Mental health support is really important. So I think employers need to be supported on how they can better support the health of carers. Because often, you know, when you're so busy looking after everybody else, you forget to look after yourself. So I think in terms of healthy diet, a bit more of a balance, and flexibility is a really important thing. And just before we started the call, Kalvinda was talking about just setting the scene to say, I might get a phone call from the hospital any minute, or you know, there's these things going on in the background. And that was exactly my situation. And you always sort of felt like you had to explain yourself when you are in workplaces or others. So I'm not quite sure what the carer's passport is, but to me, it sounds like it could be something where somebody who isn't a carer has some degree of acknowledgement and recognition that these are the challenges the individual is going through at home, and they might need to drop out of meetings suddenly, or they might need to not show up, or they might be late to meetings, and that shouldn't be judged in a negative way. It's got to be a case of respecting that individual circumstances. When it comes to hospital appointments and GP appointments, which are really, really difficult at the best of times, and especially through COVID, that's a massive struggle, because often we have to spend hours and hours on phones trying to arrange appointments. And this is a real key issue. So I think there needs to be more flexibility for when there is a situation where you've got a carer who's leaving work or having to take time out, that they should be given some level of priority. And each time somebody goes to a health service that they're meeting for the first time, they shouldn't have to repeat themselves. That's so frustrating, you know, and every time you go there, there isn't a recognition that mum and dad can't speak English or can't fully explain for themselves. So you know, some kind of a passport. I can't remember what it was called, but when dad was end of life, we filled out this form which was covering his wishes, you know, and that was such a good thing, because once that was done, it meant that every time we went to the hospital with dad, we didn't have to explain ourselves over and over again. And although you've got a lot of technology and a lot of great systems, often in practice, they don't get used. because you find yourself having to repeat yourself each time. That's right, Shaheen, the respect document, you know. So like I said, up until that point, you know, Dad had quite a lot of visits to hospital in the last few months of his life. And me and my sister in particular would go with him, found it really, really frustrating that we'd have to explain ourselves each time. So I guess it's somewhere where, you know, a database or something can be kept, and knowing, you know, what your rights are as a carer is really important. So educating people on what their rights are. And sadly, you know, sometimes you get into frustrating situations, especially for us who are from the South Asian community. We've got this growing number of elderly people who came here in the 60s and 70s. Given their life expectancy, a lot of them are in that sort of, you know, last few years of their life. So this is going to be a growing phenomenon within BME and South Asian communities. And I think it's good that this conversation started. And I'm not sure if I've covered everything that's relevant, but do let me know if there's any questions or anything else that you want us to cover at this stage. But I think I've come to the end of my allotted time. Thank you.
Thank you, Shadim, for sharing that with us. Does anybody have any questions for Shadim? Shaheen?
So thank you, first of all, for sharing your experience. Very moving, and actually everything you've said I resonate with and absolutely agree with. The respite, some of the challenges that we face from South Asian background. And one of the particular things which keeps coming again and again is care homes. We as Muslims it would be frowned upon if we put our parents in a care home. But what we also understand is that we have both people who work in a household. Things have changed. The dynamics of relationships have changed. 30 years ago, mums would stay at home, fathers would go out to work. Now we've got mums and dads working. So there's pressure within families, and it's that respite that I think, Mahbub, you've talked about. Jeff, Shadim, you said the same thing. What does respite look like for people from South Asian backgrounds? So for me, I mean, my mum's no longer here now, but if I needed the respite, I would want somebody who is similar to myself, who has the same belief and faith, to give me 3 hours so I can catch up on my sleep, and for somebody to come into my house just to look after my mum whilst I catch up on my sleep. That's what respite looks like for me. And Shadim, I'm not sure if that's what other people would think, but that's... So, I mean, Kalvinder's got a fantastic story to share. Something about diet. We can take our parents to, or our loved ones, the people we care for, into our community centres, and they've got activities. Are some of these places fit for service, fit for purpose, shall we say? So if somebody who does their 5 prayers, they will never forget those 5 prayers. They want to do those prayers, hold on to the faith. They want to eat a halal meal. What kind of services are there across? Now, I work across 5 places. That's Leeds, Kirklees, Caldale, Bradford and Wakefield. It's some services, we know that some areas are doing a fantastic job and there's great services, but it's always a hit and miss. So that's all I want to say. Thank you very much.
Thank you, Shaheen, for that. Does anybody have any more questions? Okay, thank you, Shaheen. I'd like to move on to our next speaker, Kalvinder Degan, who is caring for her parents, and she will share her lived experiences. Thank you, Kalvinder.
Right, can you hear me? Right.
There's a bit of an echo, Kalvinder.
I'm just going to... Hello?
Yeah.
Yeah, can you hear me now?
Yeah, we can hear you.
Is that better? Right. Yeah, morning,
I can't see you.
You can't see me?
No.
Oops. Don't know what's happened here. Right. Can you see me now?
Yeah.
Right. Okay. Yeah. Listening to everybody, it's really good to hear, and it's a lot of things like I've experienced. My dad got diagnosed in 2012 with vascular dementia, and I was working full time then, and mum had health issues. So, like the gentleman said before, it's language barriers, the hospital appointments. I had a brilliant job. I loved my job, but it got to a point where I was working. I'd be in a senior manager's meeting. There'd be a phone call from the hospital asking about stuff. There'd be my mum and dad on the other end of the phone, and I knew something was going to give. And I didn't want it to be my work, and I didn't want it to be my parents, but I had to make a decision. And I made the right decision. It was to leave work, take a retirement, and look after mum and dad, because, like it's been said before, in our culture, putting our parents in a home or not providing that service, especially as being a girl as well. I'm the oldest daughter, and I've got siblings, but they live abroad, they live down south, so there's just me and my brother down here in Leeds. So I gave up work, and like I said, I'm glad I did. My dad's health deteriorated, my mum's health deteriorated, and as there's an expectation, it's unsaid, but it's there, and you know that you have to look after your parents. You don't ask questions, you just do it because you want to do it. But then, you know, you've got your own family, you've got your parents' family, and there's a whole lot of issues that go around that you have to deal with. My parents' health obviously has deteriorated quite a lot, especially down in lockdown and what have you. And recently my mum's, who was the main carer for my dad, she looked after him. They kind of looked after each other, but I looked after both of them. But that's changed to me on a day-to-day basis. I'm looking after both of them. My mum's currently in hospital. My dad can't be left alone. And like we said, there's carers allowance and stuff like that. You don't do it for money, you just do it. And I didn't recognise myself like I could get carers allowance, so I haven't, and I got the wrong advice when I did try and get it. So there's a lot of things. We're not very good in our culture. We're not very good at asking for help. It's you grin and bear it. You just do it. There's dignity. There's pride. Parents have never claimed anything. They never wanted to claim, even though I think they can claim pension credit. They don't claim it. So I think sometimes we don't ask for help because we're not brought up to ask for help. We just kind of do it, and that's like a cultural thing. And one of the things that I'm really struggling with now is my brother and I are dealing with, well, looking after parents. I do the sort of day shift and he does the night shift, because mum and dad don't want anybody in the house. That they don't know who's going to come in. They don't know if they're going to speak the same language. Trying to get help for them is quite difficult. And the biggest issue we have, excuse me, that's my dad trumping, if you can hear in the background, I apologise. Culturally, the biggest thing that we're facing is the food. They want to eat their own food. They want the traditional food, which we do, but we can't. People have said, oh, you can get Meals on Wheels. Yes, you can, but it's like asking an English person, all right, you're going to have curries for 6 days. On Sunday, you'll have meat and 2 veg. Now, if you reverse that, you can't expect an Asian person who's been used to having curries nearly every day to have what I would say English food, and then on a Sunday say, all right, you can have a curry. So there's not that kind of cultural sensitive services out there that I'm aware of. And people have talked about respites. Respites are good, but when you look at it, the Leeds City Council will only do blocks of it. And sometimes, and a lot of times, you don't want block activity, respites. You just want a couple of hours here, a couple of hours there, so you can get on and do stuff. Even, I don't know, like going to get your hair done or something like that. And you need that, and you just don't get it. Care homes has been mentioned. Putting my mum and dad in a care home, they would rather commit suicide than do that, because culturally that would not be acceptable to them. It wouldn't be acceptable to me, because we don't want to do that. And again, are the care homes relevant? If you look, it's like society. If you look in society, you know, like the Black and Asian minority people, they're like here or there scattered about in their homes. That's the same sort of thing. Services, trying to get hold of services when you want to get hold of services. There's carers leads, there's social services, there's welfare, there's all sorts of stuff. Why can't there just be a one-stop shop, especially when there's people who don't speak the language? I have to do everything for both my mum and dad. I have to do it separately because they won't look at them together, which I totally understand. But it's again repeating. And then, you know, you get fed up and you just think, you know, I can't be bothered. So you just don't. And then you lose out financially because you haven't got the time. I've been caring like 3.5 years now, and it just gets worse. But you don't get the help. I don't think you get the help. It's like you have to work twice as hard. You have to do your admin twice as hard. You have to get on the phone. You have to go to the doctors, and it's repeat. You know, and things that aren't going to get better. It's like my brother. He's working full time, and he has to do the night shift. But I get here at 7 o'clock in the morning. He leaves to start work at 7:45, and then he comes back at 6. I've made the meal. I've spent time with my dad, and then we eat our traditional meal. I can't get pizzas in all the time. I can get them in now and again to help when we're having a bad day, but on a day-to-day basis, he takes over then, and I go back to my own home. I've got my own family, and it has a knock-on effect on us as the carers. And where do I go? How can I leave my dad? Like the lady just said before, she said she needs 3 hours to, you know, to do so, you know, to catch up on your sleep. Well, you do need 3 hours. You can't have a cup of coffee sometimes because you think, right, I've got to go home. I've got to sort my own family. I've got to do this, that, and the other. You know, you're just chasing. Like my brother said recently, he says, I'm running 2 homes. He says, his life is on a standstill. He can't go out like young lads do. He can't go out and meet his friends, you know, go for meals and socialise. His life has come to sort of like a standstill, and he's young. He even made like a man cave so my mum and dad could go and stay there while he was working, you know, in lockdown. But because their health deteriorated, it's not going to get used. I'd converted my dining room, so I've left it as a dining room instead of making it a through dining room into a kitchen sort of thing, because I thought, oh, my mum and dad might want to stay here, but I'm a girl, so they won't want to stay in the girls' house. They'd rather stay in a boys' house. So there's that kind of cultural difference. None of us asked to be carers, you know. If everybody was honest enough, we don't ask to be carers. We become carers, and a lot of people don't recognise the carers. I do it because I'm the daughter. I want to do it. I wouldn't swap any of this. You know, I might get emotional. I might get like I don't have a time for myself, but I would not swap it. Things that could be done, maybe some recommendations, is get the communities involved. Talk to carers from different backgrounds, not just Asian background, Black backgrounds, Chinese backgrounds. Talk to the carers. They know best. They know what they need. They know what their cultural families are wanting. And for working people, for example, I wouldn't want my brother to finish work and help me with the caring, because if he did that, he'd be coming out of a frying pan into another frying pan. Do you know what I mean? It won't work for him. Maybe if I'd stayed and I had help while I was working, I might have stayed another 6 months, but I don't know. You know, where I'm working longer, but I'm not getting paid. That's another kind of thing that you've got to think about. And the support for carers, it's not always financial, it's emotional, it's physical, because it affects their mental health, it affects their relationships with their children, with their loved ones, with their partners. And our health as carers, that deteriorates. If I've got an appointment, I'll rearrange it because I've got things to do with mum and dad. I'd rather do their stuff. My own interests, for example, I can't follow them. I was going to be a trustee for Carers Leagues. Got all sorted, and at the last minute I said I just can't do it. I can't commit myself. So yeah, and in like the shopping, you know, we all buy the same food, but we eat it differently. We cook differently. So we need to sort of take that on board. And maybe, like I said before, get the communities involved. We've got 4 temples, Sikh temples in Leeds, and they all do the different things. Why can't they all get together and work with Carers Leagues or work with Leeds City Council and sort of provide that food that them communities need? You know, it's just, there's so much, and I don't think we've all got time to sort of iron out everything. But the food's really important. The language is important. The support, you know, that we provide for our parents in our generation, my generation, that is going to be completely different to what my kids are going to do. I'll accept going in a care home. In fact, I probably want to go in a care home. Whereas my parents, no way, that ain't going to happen. So we're not asking for special treatments as people from a different culture. We're not asking for anything that other people don't get. We just want the same sort of services, but cater to our needs. So yeah, I think that kind of like sums up what I need to say without going on too much. Thank you.
Thank you so much, Kulwinder, for sharing that with us. And I understand that it's emotional to talk about these things, but thank you so much for sharing that. Does anybody have any questions for Kulwinder?
Adiba, I'm just going to pick up, I think Jeff wanted to come in.
Okay.
Saying from my background, I've always been a support worker, and there does need to be a lot more cultural side of things and educational for people from ethnic backgrounds for us to work with them. But on the other side of things, from listening to your stories, I didn't realise how my family were very similar to your social backgrounds as well, because I've always had the role of I looked after my parents because it's my job as a son, and the care can be up and down. Sometimes I'm there it's a long time, and there's lack of support by the employer, and also how you pay your bills, and also so I'm identifying a lot of similarities, but culturally there needs to be a lot more support. And plus parents, I mean, my grandma has only just gone into a nursing home because she's end of life care, and we've had to fight for her to get over to Leeds because they wanted to try and keep her in Bridlington. But I can identify with a lot of what you're saying. Sorry, I'm getting upset because it sort of brings back a lot of my memories. And I understand about the family, and also my family is very complicated as well. I have relatives that I've actually had, in that time I was with my dad was, my mum was long-term ill and disabled, and she died, and my parents were alcoholics, and my dad liver packed up, and he spent 10 weeks in hospital, and I didn't get much support from the rest of the family. And one relative, you said that one day of time, I was outside his bed for over a week, day in, day out, and I took one day off, and one of my relatives has still not spoken to me since 2013 about doing that, because I wanted to spend time with my friends. And that's the other thing, is that pressure. And I didn't spend the whole day feeling guilty, I believe in my dad. So it's that understanding, where does the support from the carers come from? But one thing I was also thinking is, formally or informally, what support is there for? I was always the person waiting for the phone call from a liver transplant. I was always doing that. Where is that sort of background that you could go over? I said the other day I had a fall, so I'm a stroke survivor now, and smacked my shoulder. and my next of kin was in Scotland. So would there be a better way of having a next of kin contact list for when people are, so you don't take all the burden, if you know what I mean, that there is other people in my family, with my grandma, there is other people that if my aunt can't do it, one of my cousins still do stuff. Is there some sort of a system that could be in place within our own families for that, or within the carer system?
Thank you, Jeff. Manjit, you've got your hand up.
Hi everybody. Yeah, it's it was more a question to Clavinda as well, but just listening to Shadim and Clavinda, obviously everything resonates, and I'm not going to repeat what they've said, but I think most of us at some time in life do find ourselves as a carer, but we don't recognise it as a carer. However, I'm not sure what the answers are, but they're definitely with the food. I mean, if there was a service where people could provide food, she mentioned something about maybe Good Brothers getting together and doing that. If the Good Brothers knew there was a need, then maybe somebody could actually provide it, but then we would need people who would actually access that need. But sitting services, I'm just wondering, like for respite care, like for like people, one of the things Clavinda said, like if somebody was going to do sitting, it would have to be somebody who would be able to speak the language, and who would be able to give that same sort of level of help to her parents as she is giving. And watching her cry and getting emotional, that's not just today. There'll be moments where carers have those moments to themselves and think, I have nobody to turn to. And I think that's where we need to be catering for as well, that carers need that support. Maybe it's just someone to be able to go out with a coffee or be able to speak and talk about what they're going through, and do it without any guilt, because no guilt is attached, because nobody chooses to become a carer. However, out of the love for our families, we just drop into there and just do it, as Jeff has just said. And like I said in the message, it's like you do become a carer and you just get on with it. And I'm recognizing that now, that most of my life I've worked part-time only to be able to support my parents in the hospital appointments and everything. But at that time, I didn't even think myself as a carer. I think the other thing, just before I finish, is it's not always just family you end up caring for. I ended up caring for my neighbour for 18 years because she had nobody else up until the day she died, and she appreciated it. But then you don't realise that actually you're doing this, and there's other people that are doing it that possibly will be getting paid because they're doing it as a profession. And maybe some of us don't actually want people to come in and care for our families. I know that there is there, but I think that comes down to money as well. Are the charges too high? If a family suddenly decides, well, yes, we've got a like-for-like carer, but we're having to pay from our pocket, and we can't pay from our pocket because we're not working, because, Clavinda's left her job, and that's the story of many.
Okay, thank you, Manjit. Mahbub, did you have a question? You're on mute.
Yeah, I think it's more comment really rather than a question. I'm just responding to Jeff's discussion on, like family members who can check on somebody else and so on if no other carers are around. I know some of the communities where the carer is in Bradford, for instance, but the immediate family members are in America. So they've been in touch with somebody else who's local, who've kind of come forward as potentially people who's, will support other people in the community. And it's really a kind of amazing kind of network they've got, where this individual can then be contacted and they'll go and check on this family member on behalf of somebody else who, not, like I says, across the seas, not even in this country. And then they'll keep feeding back that information. So on, some are doing it voluntarily, some may, have to get paid for a service, I don't know. But there's that little setup going on there at the moment. Others, like I said, with the carers, I think one of the biggest things is peer support as well, learning from other carers and getting training from other carers. And the simple things like even, suddenly become a carer, how do I move the person I'm looking after? I don't even know how to handle them. how do I bathe them? There's, very kind of simple things. And they can also create their own social networks as well in that way. One of the issues I've got at the moment, working with male carers, is despite putting in so many different activities, groups, etc., so on, and some, you jump to the chance of doing something like that, like going to the cinema or going for a, boat ride or canal boat, going fishing, etc., and so on. Carers, male carers particularly, will still struggle to come out to these activities, even though they want to. And some of it's to do with work, some of it's to do with financial issues, some of it's to do with the, like it says, the individual they're looking after and their caring duties, and getting away from those things. So one of the things I'm kind of looking at is partnering with other organisations where potentially, we could have like a group setting where, we're talking about respite care, for instance, and that looks very different for each individual and each carer. It might be, a case of I need a break, so I'm going to kind of go have a bit of my own time. But other carers are happy to bring the person they're caring for with them. And indeed, some of them won't actually even, don't want to leave the person they're caring for, because some are at the end of their life in terms of, they're at palliative care stage and so on, so they want to spend as much time as possible with them. So if we're looking at mechanisms where, the cared for could also be, participate in activities or groups along with the carer, if you like. So on one hand, the cared for is in the same building, if you like, or in like community centre, so on. And then the cared for could be doing activities, participating activities which are suitable to them. And the carer can be paired with other carers in different groups and getting on with their own activities and so on. So it's like a togetherness, but at the same time, and a bit of a break as well.
Yeah. Okay. Thank you, Mahbub. I'd like to move on to our next speaker, Akik Sadiq, who is the manager of West Bowling Youth Initiative, was also a carer, and he's here to share some of his experiences and lived experiences. Hand over to you, Akik.
Can you hear me?
Yeah.
Okay. It's good to sort of hear other people's stories to start off with. I work for West Bowling Youth Initiative. I don't really want to talk about that. I want to talk about home life, and this is my mum and dad's house. Sort of deeply religious people, as you can see in the background. Mum died April 2020 of COVID. Literally fell off a cliff. Dad died June 22nd, 2018, after a series of, well, it was age actually, he was 84, but he had dementia, delirium, diabetes, depression, all the D's I call, and finally death. And Dad died in this room actually. We managed to get him home after spending 3 months in BRI. He had numerous strokes, April onwards, and it was just so challenging going every day to BRI and sort of stroking his head and telling him everything's going to be all right. And we finally got him home. It was leading up to that. So with mum and dad, things started to go downhill around 10, 11 years ago. And that's where, as a family, we pulled together, my siblings, my 2 sisters and my brother, and carers from the outside. So mum went on a dialysis around 2009. And that involved 3 trips to St. Luke's Hospital, and a lot of aftercare and worrying about low blood pressure and all the things associated with dialysis. And then that sort of, she did well. She went through 5 or 6, 7 years where she was okay and independent. Dad has always been independent up till his 80s, and then he started losing his teeth, 82, 83. And then around 2017, he couldn't drive the car, which were killing him actually. We stopped him from driving a car when he drove into a bin one day and half the street was shouting at him. The challenges, I'm going to talk about challenges and then opportunities. One thing I must say from the beginning, it was a great opportunity the last 5, 10 years for me to spend a lot of time with my mum and dad. And I don't look back at it in any sort of negative form. Yes, there were problems with my health and I've had diabetes and other issues, but that last 5, sort of 6 years of my life, I spent some quality time with mum and dad, which I'm glad, because we worked through his 20s and 30s and 40s, but in my 50s, I've got fond memories of having fish and chips with my mum at BRI and sitting down with her and having a tray. And it wasn't something she was used to. With Dad, taking him to DIY places, you know, when I had the spare hour in the afternoon. I work locally and it helped. My sisters, one works up in Newcastle, the other one's up at Saltaire. And, you know, we had a, once my dad died, and then the day my dad died, life just went, my mum had a stroke. So she ended up in Ward 6 for another month. And we had to literally get a diary, look at our work and lifestyles. And literally I was staying over Sunday, Monday, Tuesday, doing breakfast for mum. She'd stopped cooking after 50 years. She said she's had enough. That's when she came back from hospital. So it's been topsy-turvy, but both our parents have gone. They're in the graves. We still haven't really got over it, if I'm being honest. I try to talk about it a lot more than my siblings. I really worry that my sisters don't really talk about my mum and dad, and they sort of bottle things up. And Dad's, like I said, 4 years this month. So those are the family challenges. When they were alive and I was the carer amongst a number of carers here, the challenges that people have said is like on your time, on your routines, you know, just, you know, appointments, diet and food and stuff, and, you know, trying to make sure that our elders are fed and they're eating the right food, and they don't go hungry. You know, they had diabetes and tablets. Lots of times the tablets were missed, and, you know, tablets were on the floor, and you're thinking, what's going on here? And loads of sort of personal challenges. For me, like I said, I don't regret it. Yes, there was pressure of work, running a charity, involved in a local cricket club, but nothing's more important than your family. And I think one thing that's overriding for me is that my parents became my children, because I didn't have any children. And I realized that you have to be up at 8 o'clock, and mum needs feeding at 8:30, and dad needs to be doing this at 10, and 1 o'clock prayers and 6 o'clock appointments, carers coming in. So you sort of shift your life around having structure. I'm not the best for structures and routines working in the voluntary sector, but however, the voluntary sector does give you flexibility, and I don't feel as if I'm a robot and tied down to a council job or a job which is routines. And throughout, like I said, I think the important thing is that it was genuine care for our parents. And like I said earlier, I don't think I've left anything behind. My parents have gone, and I feel sort of content that I did everything I could do at that time. And yeah, they always used to complain, can you do this and do that? And you're thinking, it's 12:30, I haven't started work and I need to go now, but can you, obviously mum had Monday, Wednesday, Friday appointments with dialysis. So I used to use Tuesdays and Thursdays as my sort of, right, I need to really focus on my work, and those other 3 days. And at no stage did I have that feeling, oh, this is going to end after so many years at this time. That wasn't in the equation. Again, going back to opportunities, like I said, the quality time that's spent in the last few years with mum and dad, and it was interesting because dad had dementia, then delirium. Delirium was really difficult for me. I was once feeding my dad, and I turned around, I think he had some soup, he didn't have any teeth, if I remember. And then I've turned around and he's put his fingers in his mouth and he's eating his fingers. And then he's picked something else up, and it really shook me, it really did. I remember it upstairs, and I had to just keep it together. I vividly remember that moment. I thought, my goodness, this old man is so vulnerable and he's suffering, and thankfully we're around him. And Dad slowly deteriorated. He ended up, like I said, in hospital for 3 months, at BRI. And then there was a time where they moved him from BRI to a community hospital up in Westwood. And that was the worst experience of my life. I went in on a Wednesday and he was crying, and there was food all over the place. There was loud music being played, and the carers or the place there, I mean, it was disgusting. And I saw him, I stopped there, and the staff were not very good either, but I thought, we've put this person into care through the hospital and we're not there, and this is what happens to your parents. So unfortunately, the next day I had another stroke, which was the Thursday night, and me and my wife rushed over. And when he was back in BRI, there was a sense of comfort that he's in somewhere where he's been cared for properly. And that was an experience which I will share with anybody. And part of this is about the past for me, where we are now, but also the future is helping other people, especially young lads who I work with in the communities, that look, you better be ready for this, because nobody talks about bereavement and care and these sort of things as you get older, and it takes over your life. It's the biggest priority in your life, above anything else that you do, family, cricket, this and other, your hobbies and interests, your parents and their needs, especially vulnerable parents, their needs come to the top of the tree. We did get carers in for my mum once Dad had passed away, and we had Tuesday and Thursday, we had a couple of ladies who came in and sat with Mum, generally 1 till 3 o'clock. And that was nice, because then all of us could just go chill out and do stuff. But occasionally when a carer didn't come in, then I felt a bit, I needed to be here or make sure I work at home on a Thursday afternoon, because Mum was left vulnerable, especially when it was the dark nights and the light came in early. I remember she used to fret a little bit, my mum. My mum was a legend because she had lots of friends in the area, and people used to come and sit and gap shop, chit chat with her and stuff. But when she went, I think even now when I'm out on the street, some of the ladies in the area, they're sort of saying, "Oh, we miss your mum." And I says, "Don't I know it?" She was like my queen and stuff. And I had that bond of being the oldest son with my mum. I don't know what it is, and I talk to other people, but I was lucky that when she got COVID on the Monday, she died on the Friday, and I was with her. I was holding her hand, and then I got COVID, passed it on to my wife. She got COVID. She then had a stroke, my missus. Then she had a pacemaker. It was just a succession of things that happened, and you really got to reflect on what life's about. I think for me, whether it's carers or work, value doesn't matter. For me, it's about values, about family values, community values. And one thing that, I might not mention, but throughout the last 5-10 years, a lot of the community and the family pulled together, and our friends, my work colleagues were really sympathetic to my needs, taking time out and knowing that we've got elders, that appointments, this, that, and other. So luckily, working in the voluntary sector and having trustees who are understanding, that was really okay for me, because I've passed that on to the local nursery where I'm the chair, or my colleagues at work where their parents have suffered. So giving people time out, 2-3 months to sort out what's important in their life is important, because work never goes away. There's always work. Tomorrow there's work to do. Next week there's work to do. So work's always there, but ensuring people are comfortable, deal with their loved ones, and take time out. Whichever, we have to find a way. We the nursery across the road here, that one of the girls, her father's ill in Pakistan, and we've just said, look, go on sick long term. I'm okay with it. I'm the chair. The manager's okay with it. We'll cover your work. Don't worry. Take time out and deal with what's important in your life. And coming back to our own health, I think I suffered in terms of when I was sort of caring for my mum 3 days a week. My sleep really suffered. I remember I was like so tired at the start of the week, and getting up at 5 in the morning and just checking in with mum, and then not eating properly. Then I got diabetes in 2018, and I've had my own health issues prior to that. 2012, I had high blood pressure, which had rocketed, and that was just unhealthy living. That was not to do with my parents, but that's just a little sort of summary and story of what's happened now and in future. Like I said, I think I'd like my siblings to be a bit more, well, I wish they'd communicate a little bit better and speak and talk about if not to me, to somebody else. And then, like I said, I sort of pass on information to my colleagues and friends at work, at the cricket club, and I've got lots of contacts. They said, look, just be aware of what's around the corner and spend time with your mums and dads. That's what I keep saying. Look, quality time, take them out. Don't just, take it for granted that they're the grandparents and they're doing things. You don't want to be having regrets later on. And I'll stop there.
Thank you, Hakeek, for sharing that with us. Does anybody have any questions for Hakeek? Manju, you've got your hand up. Is that a legacy hand?
That's from before, sorry. I'll take
Okay.
it.
Shane?
I'd just like to ask Hakeek that have you had any bereavement support? And if you haven't, why?
Good question. In actual fact, I needed bereavement support in 2004 when I saw a young kid burn alive, literally up the road. And for 2-3 days, my life was. I find with my parents passing, I won't say I'm 100% okay, but I think it was important to let out the emotions and cry when it happened, and then talk about it and stuff. So no, I haven't had any bereavement support, and it's something which, well, I need to look at, but I think people around us need to look at. It's something which I think we take it for granted, or we don't know much about. We got lots of leaflets when mum and dad were in and out of hospitals, and we read a lot of stuff. But our focus wasn't us; it was them. The concept dad, he literally went from a 14-stone guy to a 10-stone skeleton, and he didn't eat for 3 months. So eventually we got him home, and then he died at home. And I think a lot of us were comfortable with that. And then with mum, with what happened so quickly, and COVID, I mean, obviously, though at that time, 200 people a day were dying, and the graveyards are full, if you only go up to Cemetery Road. So I'm not the only one that probably needs bereavement help, but I think I'm okay. I think I've sort of talk about it, and when there's time to talk about it. But bereavement comes in waves, I think. Sometimes a little thing can really set you off. You're watching a film and something upsets you. There's other times when you're fine, and I'm involved in cricket. I run junior teams, I run a club. We played last night, over 50s game. So as long as I've got other things that help me in terms of my health, yeah, I probably need to, I'm not saying I don't need bereavement help, but I need to maybe open my eyes and ears.
Yeah, thank you. Okay. Huma?
Hakeek, I just wanted to ask, thank you so much for sharing your experiences, and I'm sorry to hear about the loss of both your parents. Were there any support groups for you, like, with other individuals from ethnic minority communities that you could tap into? Were there any services that you could access for support?
For my mum, we got carers in, and I think it was through the council, so we paid for that service. When I think, looking back, it was probably more difficult when dad was really ill and he had dementia and delirium, and then mum had her own health issues, and I would often getting phone calls and saying, look, come home, dad's trying to walk down the steps when there's a stair lift, and appointments and so on. So there was a period where it was quite stressful, but no, to be honest, in terms of support, what's out there, we probably know a little bit more now than then, and probably that's the case with all things. When you're caught up in a whirlwind, or a storm in life, you're dealing with everyday matters rather than looking for support and help. But like I said, there's 4 siblings, there's my wife, there was a few other people, and I like to take ownership of things. Whether it's at work or the cricket club, I like to think that, as a family, we had a diary, we communicated really well. There was never a time where our parents felt vulnerable, left alone for more than an hour or two. I think we did okay. Like I said earlier, I'm happy that I did everything I could do. I didn't leave anything behind, and I'm sort of comfortable in my own skin of my parents passing and their legacies and what they did. And we're finding out more and more about them, what happened in 1958, 64, 65. And the stories are coming out. And just little things like, I think last year that I found an old briefcase with loads of papers in, and it just brought tears out. I saw my dad, he finished mortgage in 90 and took a loan out for a dormer, but then he bought a sewing machine for my mum. And I remember those moments. I thought, wow, these are the invoices they've kept, and the struggle they had for us to get us, you know, our sisters and brothers, we all got educated and we've done well. Dad worked in a mill, so like I said, you have to give back. And you know, parents bring us up, and then we have to give back. And I don't have a problem with that. And when I see other families and the stories I hear, I just think, wow, you know.
Yeah.
You don't know what
and I think, thank you, Takik, and I think it's that cultural expectation, you know, that we, you know, that our parents have of us. You know, I'm a carer for my mum also, and I work in the voluntary sector, so I know the challenges that come with it. But it's just about services being more accommodating to meet the cultural needs, you know, of diverse communities, and that's what we're hoping to get out of, you know, the work that we're doing with the West Yorkshire Healthcare Partnership. So thank you for sharing that.
Okay, thank you, Huma and Hakik. From Mehbooba Manjit, can I ask you to just share your questions or comments in the chat box, because I'm just a bit curious of time and we have another speaker. So I'd like to introduce you to Rubina Burhan. Rubina is the manager at Gillington Community Centre. And again, thank you for attending and sharing your experiences. So I'd like to hand over to you, Rubina, please.
Thank you, Adiba. Can people hear me? Yeah. Right. My name is Rubina Burhan. I work in a community center. I have very mixed feelings. I didn't realize I have to sit down for 2 hours. So I thought I'll comment. But anyway, it has been very emotional listening to people. Most of the carers have been looking after their parents. Very interesting for me, because I would like to say that with new generation, things are changing. And I think the systems and whether it's social services or NHS, our voluntary sector, we need to really recognize that we have our children who have their own families to look after. Now, it was interesting to listen to Hakik. Very, very emotional, and Kulwinder, how and I think it was other people who also looked after their parents. Very emotional thing to hear, that how they put their parents first before their personal needs and family needs and their careers. I will go back to my own introduction first. I manage a community center. And in my community center, it's like a one-stop shop. Someone mentioned that we offer welfare advice services to people. So when it comes to carers, all the advice is available, and people with disability. We also do health and well-being. So for me, I'm looking from both ends. On one side, as a professional, offering services to carers in our community. On other side, I am carer myself, and how I struggle. Someone who manage a service which is offering support to carers. When I needed support, there was no one there, and this is what I want to share. That I know how the system works. I know what services are available, but I struggle, and I just wanted to share that with my other attendees here. So in 2020, we had COVID. My husband and I had COVID, and my husband's condition deteriorated. He started to really forget things. He couldn't cope physically and mentally. He now has been kind of seen as a patient of dementia. But at that time, we were not sure that whether it was just memory loss, short-term memory loss. So I had COVID, but I was able to recover, but my husband didn't. He had to go to hospital and spend few days in hospital. When the reason I'm giving this example, how the system, lack of system approach to support carers and families in crisis. So my husband, when he came, he kept falling down. So once he fell, I had to call ambulance middle of the night because I couldn't lift him. And 2 people came, they couldn't lift him. Then another ambulance came, 4 people actually managed to lift him and put him on a sofa bed. So I asked social services, can the occupational therapy department, can they help me, give me some tools, some, beside the bed, and also something to help me to lift my husband. I needed to learn how to do it without hurting myself, because I started to have sciatica and backache because helping him to lift from the sofa. And it was September, and it took 3 months for someone to contact me to say, we are ready to come and train you. And this is an example where system fails you because there are deadlines. There are kind of for people to say, we are not available, we have got waiting list, and carers there when they need immediate help, when they are in crisis. They have to cope themselves. And I think that example for me has been a lesson when I work in a community center, how to make sure we offer timely, support, which is, timely manner, not actually after 3 months saying we are here to help you when it's too late. I think for me, what my colleagues and my other attendees have shared, I am slightly different because I'm wife, I have a job, I have 4 children, but I don't expect my children to give up their lives to come and help me to manage as a carer and support my husband and myself. So I try to do it very independently myself, and it is a struggle. It's a struggle because I feel the system doesn't work for me. If I'll give you an example, if I asked when my husband was ill and I asked for help, they said, oh, you don't have smoke alarm. I said, no, I don't care about the smoke alarm, it's not working. I need someone to come and help me with A, B, C, D. And the next day, I didn't get any help, but someone came and dropped smoke alarm. So for me I'm asking for apple, I'm given oranges. I'm asking for banana, I'm given pear. And this is how the system fail people, where the needs are not met in timely manner, and the needs which as a carer I needed help with, those needs are not actually looked at as in an immediate way. Is after 3 months, if you're offered that service, that is too late. By then I learned on internet how to actually help my husband to get up, putting a small stool and a chair, and then step by step help him to get up without injuring myself. It was like a self kind of learning for me. I think as a manager of the center and as a carer, I will say is that as in a BAME communities, the system sometimes fail us because the system is looking in a very set way to help people, and it's not appropriate for families from BAME communities. And the examples have been given already. I don't have to give more examples, but how people access services, that is carer services, people don't know. When you're in crisis, I'm a manager of a services, we provide services to carer. I was struggling to access the service. How do my service user, people from our community who have very little knowledge of system and what help is available, how would they access those services? Again, in timely manner, because when the services offer, often is too late. It needs to be at the time when families need it, or the carer needs it. I'll just say another example of lack of information or access. Girlington Centre, where I work, we offer end-of-life support. It's part of one of the system which probably Huma knows. It's a RIC project, reducing inequalities. So that funding is made available for end-of-life carers and the families. And we are struggling to get referrals. There are hardly any referrals coming through GPs and from the system. So even though the service has been developed, people are not aware of that service, and the professional in the health system are not aware of that service. So for me is, when you are developing services within system, how do you make sure that the carers, especially from BAME communities where cultural language barriers, they know about what services out there for them to benefit from. I think for me is, I don't want to really carry on talking. Most of the stuff has been covered by previous speakers. The only thing I will say is that expectation from the system is, if that is expectation, I think we need to really say that new generation, the people we talked about here, are the generation who did care about their families and their parents. I think time is changing, and we need to recognize that. We need to recognize that our next generation, our children, may not have the resources and the time or capacity to look after their parents. And it's a big issue within the system. How do we make sure to help those individuals and the families to cope with the carers and the person who needs caring? And I think I will stop there. I don't think I need to add more, because people, experts are sitting there. I can see Mahbub there and other people who have been in this field for a long time. Thank you.
Thank you, Rubina. Thank you for sharing that with us. Does anybody have any questions for Rubina? Shane?
Sorry, Rubina, thank you very much for sharing your story. We go back many years. So
I know.
Really lovely to see you. As the manager for the community centre, what I wanted to ask you is, do you know about some of the policies or perhaps guidance as a manager to support working carers?
Policies and procedure for our organisation or in general?
For your organisation, and in particular in supporting, or guidance which supports working carers?
I think we have our own policies. What I'm talking about is in practice, voluntary sector, and from my experience, community centre, we offer all the support we can. But I want to make this point, Shaheen, is that voluntary sectors is dealing with a lot of expectation from the communities. Lot of need and demand is there, especially for organization like Girlington Center, which is based in the heart of the community, and we recognize the need is there, and people have expectation. However, within the system, voluntary sector and the locality like Girlington, where do we fit in to meet that need? Because the resources are not made available for the locally based services which are accessible to people. So I'm wearing my manager hat to answer your question, is that even though there are organizations in Bradford who are catering for BAME community needs, however, and their services are very accessible to local communities, but the resources these local community organizations, they don't have those resources to meet the demand for those people. And that is a struggle we have, where on one hand we see the need, and we see we want to do this. We have like a dementia cafe. We work with, we have a lot of services since you left long time ago. We have a lot of services. We have health and well-being cafe. So we have a big health and well-being team where we work with people with dementia. We have autism projects, so a lot of projects going on in our center. However, what my point is that as an employer, we can support our employees by being flexible, as we don't pay enough wages, because we the staff who work in our organization are committed to serve the community, despite very low pay. The only thing we can offer is flexible hours and help with their caring needs. So I think I'm not the only one as a community organization. I'm sure there will be many other in West Yorkshire and in Bradford particular, where we see the need, but we are not able to provide that need as we would like to.
Thank you very much. Can I just say, Rabina, that I have utmost respect for the voluntary community sector and all the work which happens on the ground, and for you to lead, for yourself and all the other organisations who lead this work and do that work on the ground. It's, I mean, I've been there, I've been part of that myself, and I've absolutely most respect for what you guys do on the ground. It's about now connecting those dots. Like some of the things that I've heard were new, but I'm away from the voluntary community sector to know who does what. We work across a very large area, so we're not just covering Bradford. But what I was thinking, and as I hear more, is how do we actually get the awareness out there that this is what Leeds provides, this is what the community centres provide, and I think it's the lack of that people do not have an understanding of. So for instance, your bereavement support, I think that would be fantastic to get that out there. Why is that message not going out of there? So it's perhaps looking at that one-stop shop somebody mentioned earlier on, having a place, a portal, whether it's the website. I know some of us are very digitally included, some people are not, but how do we get all these services which provide amazing stuff in a place that somebody can go onto the internet and say, right, I could do with this sits right within my area and I can pick this up. So that would be my sort of reflection, really.
I think it will be ideal for people who can have access to IT systems and digital awareness. I think we are serving the communities like in Girlington. We have three set of communities. We have Roma communities, Eastern European community. We have Pakistani and South Asian community, and then we have refugees. So three different communities have different needs, different languages, different cultural needs. So I think digital awareness and that one-stop shop on digital platform is very helpful. But also I think we need to really look at alternative way of supporting those carers and families.
Thank you.
Adiba, I'm just looking at the chat box, just a few really valid points. Jeanette said that councils need to look at daycare provision and respite needs for carers of all backgrounds and cultures, and work closely with carers groups and relevant organisations, community groups, etc., to make sure that they are more inclusive. Call today carers wellbeing service encourages carers to complete an emergency backup plan. And it's just something from Mahbub a little bit earlier on. He's saying recognising oneself as a carer is an issue, and then asking for support. Repetition is a common theme, as is a request for one-stop shop for addressing support needs. So that commonality amongst all the participants here today, saying that there needs to be more focus around a one-stop shop. But having led on the COVID prevention project, I can certainly say that we understood the challenges that ethnic minority communities have in accessing online services. So the approaches that we took was to create lots of different videos in different languages, using our community champions to really get the messages out there. And I think what really worked was lived experiences as well. So like Rabina, Kulvinder, Haqiq, Shadim, they've all shared their lived experiences, and I think that's what we need. We need carers champions who can actually record messages and share their own experiences to encourage and support other carers, and definitely a need for support groups as well. Somebody on Monday, we had the webinar on Monday, which was aimed at working within a local authority, and they said, look, this is the first time that I've ever spoken out, in a platform like this, online platform, but it's really important that we have these conversations. So I think there's a lot for Shaheen to take back to West Yorkshire Health and Care Partnership, and I'm sure she's going to be working really closely with people on the on the webinar today, like Claire and Rabina, Haqiq. We need to get these people involved to look at what really works within our communities. So it's been a wonderful session, and I'd just like to thank everybody for attending. We have, as Adiba said, done some work around message in a bottle, around contingency planning for carers in case one of your loved one falls ill. Emergency services have to come to the house. How would they find out where their emergency details are? So Fatima is going to share the link within the chat box. These messages are in 7 different languages, so they're up on the REN YouTube channel, West Yorkshire and Healthcare Partnerships website as well. So please do have a look at that, and please share that. Adiba can share these with everybody on WhatsApp as well, and share it with your loved ones, because it's really important that we do have some backup plans for just in case our loved ones get ill. I'll bring Jeff in. Sorry, Adiba, I've just kind of taken over.
Yeah,
I just wanted to make those
sorry,
points.
I've got my cat decided that she wants to join in as well.
All right.
She does. So I apologise. First thing is that because charity I work for Different Strokes is for stroke survivors, for by stroke survivors, but we would like to connect more with the ethnic community, the BAME communities. I have emailed virtually every mosque in the West Yorkshire, and not one has come back to me. I would like to be able to, again, for example, it might be the community centre, the peer-to-peer support, but also to link in with other stroke survivors and their families or friends as well. But one of the things, how would it be possible, and that would it be possible for us to connect as an organisation, so we could actually learn from each other and that side of things. I do go into schools often, mainly in the Bradford area, and speak to children from different backgrounds, and it's quite good to try and educate them. But would that be possible to any of your organisations?
Yeah, Rabina, do you want to answer that? Because
yes,
okay.
I was just actually typing. I'm so slow in typing, I might as well just say it. Yeah, I would love to. We are just having a diabetes week event tomorrow, and I was looking for someone who could come and talk about strokes, because so much related to, risk of diabetes. So I would ask Fatma to give my email to you, so you can email it to me.
That'd be
I
great.
think it will be an excellent opportunity for us to really work with yourselves, because I was looking for someone to really come and talk about stroke to our service users. Thank you. Thank
Okay,
you.
That's what
Thank
we
you.
like to see. Look, people are connecting and
Thank
looking
you.
at how they can work with one another, and it's all about connections that you can make. Like we at Race Equality Network have got a membership of 40 plus organizations that we've worked with, who work with ethnic minority communities. So we get asked a lot as to how we can engage on different subject matters with the diverse communities that we work and who are within our membership. So please feel free to contact Adiba or Fatima or myself, and we can really help and support. And we will be feeding all this back to Shaheen and her team as well. So yeah, Shaheen, do you just want to say a few words before we close?
Yeah, I think the sort of last couple of things I'd like to say is that, first of all, it's been incredibly brave of everyone to share their stories, because I was in that position on Monday, and it's never easy to talk about your personal experiences, because something that I've been taught at a very young age is that you don't talk about what's going on behind closed doors, whatever that looks like, whether it's marriage, whether it's the responsibility of something. So when we talk about these things, we're actually educating, and people are learning from some of our things. And not only people are learning, they're able to action some of these things. So I'd like to thank everyone for that. And also the other thing is, what I've realized is I hope that this isn't the first and last time that we see each other. We can connect with each other somewhere along the line for other things. The other things people probably know is that I've done a lot of work around bereavement. I've been the chaplain at BRI for 12 years, and I'm seconded here on the unpaid carers program. Although my focus is unpaid carers, but I'm also looking at mental health for people from ethnically diverse communities alongside with bereavement. So yes, we have got challenges, and there's also opportunities which come along with challenges. I think sometimes what I've been hearing is that some of our areas across our places are doing some fantastic work, but it's about, if that work is happening, it's perhaps they've got the funding to do that. Can we look at who else also needs the funding? Funding is an issue for the VCSE sector, we know that, but that is where all the hard work and the grassroots level work happens. So I suppose for me, in terms of reporting to NHS England and improvement, this is what we've delivered on our webinars. These were some of the challenges, and we've got to hold people to task and to say, there is probably an issue. I know that nobody's quite said that, but I am sensing that there are those kind of challenges, because I've heard that previously. So I just want to thank each and every one of you for participating and moving forward, strengthening our relationship and cross-partnership working.
Thank you, Shaheen. If no one's has anybody got any further questions or comments? Okay, I'd like to thank everyone for joining today. We will be hosting our final webinar tomorrow, which is the working carers in the health and care setting, which starts at 10 a.m. to 12 p.m. I'd like to thank Haqiq, Kulvinder, Rubina and Shadim for taking their time out to share their experiences with us. And I hope it's been a learning curve for everyone. Again, if anybody wants further information, we've put our details into the chat box. Feel free to contact us. And hopefully it's been a worthwhile webinar for everyone.
And thank you also to Claire for sharing the work that you're doing within your organisation and supporting the wider communities as well. So thank you, everybody, and I hope you found it useful. Thank you, Adiba. Fatima,
Jeanette's got her hand. Did you have your hand up? Okay.
No, I was just a thumbs up. Yeah.
Okay. I hope you found it useful. And thank you, everybody.
Yeah.
Thank you.
Shaheen, Fatima, and Adiba, can you stay on, please? Yeah.
Thank you, everyone.
Thank you.
Thank you. Nice to meet you all.
Thank
Take care,
you. Thank you, everybody.